left leg. In the left leg, which muscle was weak?
This inside one.
Okay.
Membranous.
Membranous. And in this one, bicep femoris and membranous. Okay. Then right here. Okay. Right. Membranous.
On both sides.
And left
Right. Biceps. Femoris. Left. Membranous. Okay. For the weak and stiffs, you can use the two pen. Okay. If there is the pen, then you can use the red marker. Okay. If there is a pen, for example, the pen of the semi group is not always here. Where is the pen? Pen is here. First write where the patient is complaining pain. Okay. Then we'll mark the patient is complaining pain here. Then mark this red one. This is the pain. So red color for the pain. Then we'll use green color. Which muscle are the weak? So these three were weak. The green one is for weak muscles. Okay. Use the black color. Which muscle are stiff? And in his condition, the semitendinous is for the stiff. Then this one is the stiff. Understands? Red color to highlight the pain. Okay. Green color, to mark the where is the weakness, and the black one for the stiffness. Because now slowly he will treat every day 10 patients. Maybe he will not remember each patient history. Okay. So when you will go, if one day if you are not here, then our classmate, they can see the chart, and this is the weakness, this is the stiffness, this is the case. So they can fix very easily.
So it will be changing also, no? As the patient will come.
Then
His pain and everything will be changing. So then how will you know?
So if the pain is changing, what we'll do, 2-3 sessions we'll do the same protocol, because if there is responding. Okay. After that, use just new sheet, stapler this one, and write it the date, because we already mentioned the date. This is the old one, this is the new one. So what is the improvement?
progression.
Yeah. So we can see that improvement. Understand?
Yes. Every time he comes, we have to write the date also.
Not every time. It will take like 2 to 3 sessions to change the, because we have to work at least 2-3 sessions on that same case history.
Okay.
Sometimes the body is confusing. Today was hair pain, tomorrow is going. But what was the first day diagnosis? That was the actual diagnosis. Okay. So after the needling, sometimes moving because of the gas also, because of the fascia also. So we'll not move backside the pain. Pain is going here, we'll go here. No. What we did diagnosis, we will continue 2-3 days, continue on that. Okay. After that, we'll check once again, and we'll make the new sheet, and then we'll start the new protocol. But after the improvement, we have to see if there is improvement. Otherwise, we have to continue on the weakness. Okay. So his case was like weakness in the
Semi-membranous.
Membranous is the
Main.
both are
Both
membranous.
are semi-membranous.
Right side
is also
bicep femoris.
Biceps femoris.
Okay. So whenever we are targeting the bicep femoris and semitendinosus, no. So we'll try to target above the half of the thigh. Okay. Because this side, this part is more filament, but the semi-membranous is filament is more below the half of the thigh. Because of the member, no, more member. Okay. So if you remember, if any muscle are the long muscle, they will respond starting 45 degree. Short muscle will respond after 45. So this is the short muscle. It will respond after 45 degrees. So toward of the more insertion path. Got it? Can you give it to Sri the 40 size needle?
So my stiffness is coming from, for me the stiff was all the other muscles are stiff.
Both muscles are stiff.
Yeah.
The semi-tendinosus
Semi-tendinosus is
both are stiff.
stiff.
Yeah.
Okay, and this weakness is traveling. They will create a stiffness in your lower back.
Yes, it does.
The hamstring weakness that will create a stiffness in your lower back. When will come on your shoulder, then we'll match with this, and your shoulder issues, where is the problems. Okay. Bicep femoris is very important muscle. It's connected with many multiple muscles. It's traveling like from the here to that side on the right shoulder.
Yeah, so my left is right and right.
Yeah. Okay, lie down on your stomach face down.